My name is Dr. Joshua Keyes Pope. I'm Assistant Medical Director for Hospice of the Foothills. They are now operating in Pickens, Oconee, Anderson, as well as Greenville counties. One of the things I really love most about my job is that I get to help mortal human beings transition through a really rough and difficult period in their lives and help to give support and education to families about the dying process and how we make this transition to the next plane of existence. I think one of the things that sets Hospice of the Foothills apart from other hospice agencies are several things. The first is that all our staff are local. They're your friends, your neighbors, your family, and they are all really compassionate and they really care about our patients, they care about our families. We show up even if it's 3 a.m. It's something that we always want to be there to help provide that support to families and patients. We have several different facilities that are able to capture and support our families, especially when patients are having really increased symptom burden. Those facilities are Greenville Memorial Hospital, where we have a general inpatient hospice unit for patients that are having very severe symptoms at end of life, as well as the Cottingham House, which is a really wonderful place. It has really wonderful caring staff. It helps provide patients care and compassion in that final chapter of their lives. One of the other things that I think makes Hospice of the Foothills unique is that we have a 5-star rating. All of the feedback that we get from our family members is always very positive, and we're in the top percentiles in the country in terms of the care that we provide. Care that we provide is compassionate, it's kind, it's gentle, and it's very caring and very thorough. What's really great about hospice care is the team that's involved. Those team members consist of providers like myself. We're able to come out, prescribe medicines, talk with family, figure out what's most important to them. We have nurses who are our main component of hospice care. We're making regular visits throughout the week to help make sure that you're well cared for, that you're comfortable. We're in constant communication with the doctors and nurse practitioners to make sure that your symptoms are well controlled. We also have social workers to help the family and the patient with any psychological or any mental difficulties that come with hospice care and with the dying process. We also have spiritual counselors to help address any of the spiritual concerns that we have in being a dying human. We also have certified nursing assistants. And then finally, we have volunteers. We have a core of volunteers that are able to come out and help provide any of that extra support that sometimes families find they need. One of the things that makes Hospice of the Foothills really unique is our Sentimental Journeys program. And this is a program that helps patients to achieve some of the last things that they really want to do, knowing that their bodies are in a difficult stage of their life. Some of the things and examples that we use are going on one last fishing trip, getting our family and going to the zoo for a trip. We're also developing a virtual reality program for patients that are too weak and sitting in bed and have always wanted to go to Paris, but just don't have the energy to anymore. One of the things that Hospice of the Foothills wants to provide is bringing Paris to you. I think what's really great about hospice care is there's so many things that are provided to patients and their families. The first thing is that we are able to provide a lot of medical equipment that includes hospital beds, oxygen, chucks pads, any medical equipment that the family needs to help take the best care of their loved one. We will provide and cover most of your comfort medications, in fact, the majority of many of your medications. And that's one of the things that the provider and the patient will have discussions about during their first week is which medications to continue, which medications to discontinue, and that's a very collaborative process that goes on. One of the things that's great about Hospice of the Foothills is that we're able to provide what's called Hospice 101. And these are for family members that are saying, is hospice right for me? And what we're able to provide with our Hospice 101s is that we are able to come out to the home, provide an evaluation, help answer any questions or concerns that patients and families have, help them make them feel supported during this really difficult time. I think if you're interested in hospice care for either yourself or one of your loved ones, there are several ways to reach out. The first is to call us. That number can be found right on our website. There will usually be one of our staff members that are happy to answer any questions, any concerns that you have, and help guide you through that process to see, is hospice right for you? Is that something you would want, and how we can help best support and provide that care for you. The second would be to talk to your provider, and they're happy to place a referral to Hospice of the Foothills if that's something you'd be interested in. I think the most important thing is to remember you can always contact us, and we're happy to come perform an evaluation, happy to help answer any questions or concerns you might have, and want to be here to support you and figure out how we can best do that.